Hello, and welcome to the Evelyn Y. Davis Studios at the National Press Foundation. Today, we're talking about young children and the COVID vaccine. I'm Sandy Johnson, President Emeritus of the National Press Foundation. Before we start, I'd like to mention two upcoming NPF opportunities for journalists. NPF is offering awards to honor reporting excellence on poverty and inequality and the impact on families in the U.S. You must attend or watch at least 2 NPF poverty trainings to qualify. The deadline to apply is January 17th. The second opportunity is a 5-day expenses paid fellowship on accountability journalism. You'll learn data skills, sources, and best practices to hold federal and state governments accountable for how taxpayer dollars are spent. Apply by November 29th. That's a Monday after Thanksgiving. Right now, we're helping journalists report on the COVID vaccine and children. In October, the FDA approved emergency use of the COVID vaccine for children ages 5 through 11 after clinical trials showed 90% effectiveness and no serious side effects. With us today are Dr. Lena Wen, emergency physician and professor of health policy and management at the George Washington University Milken Institute of Public Health, Dr. Sean O'Leary, pediatrics professor at the University of Colorado School of Medicine and Children's Hospital, as well as vice chair of the American Academy of Pediatrics Committee on Infectious Diseases, and Rachima Pradhan, national correspondent for Kaiser Health News. Welcome. Dr. Wen, tell us how COVID has been sickening children.
Sure. Well, I am, first of all, very glad to be joining all of you today and delighted to be part of this conversation on an important topic that's very close to my heart because I have 2 little kids. Unfortunately, they are in the age range that is too young to receive the vaccine. So I have a 1.5-year-old and a son who just turned 4. And so I'm actually looking at the kids in the 5 to 11 category, the 5 to 11 age range with a lot of envy because I and my husband would love to give our children the level of protection that we now enjoy. We would love to have the peace of mind to be able to resume many of our pre-pandemic activities in a way that we have not. And so I'm glad that you asked this very important level setting question of how has COVID affected children? Because there has been a false and pervasive narrative that somehow children, especially younger children, are immune to COVID. And I think this narrative came about because it is true that children tend to become much less ill due to COVID compared to adults. But I would argue that this is exactly the wrong comparison because children are not supposed to become ill. Children are not supposed to die. You look at something like COVID that is a new virus that came out of nowhere, and within less than 2 years, it is now one of the top 10 leading causes of death in children, including younger children. And so I think the comparison really is wrong. In fact, I wrote a column about this several months ago where I said, what if we imagined, and instead of this comparison of children versus people who are 75 and above, which is, again, just not the right comparison, what if we imagine that there is a new illness that's here that only sickens children, where tens of thousands of children have been hospitalized? More than 600 of them have died, including dozens of younger children, where there are thousands of children who have had this multi-system inflammatory syndrome that affects multiple organ systems, where potentially many thousands of children could be living with long-term consequences of this illness. How might we process that differently? And by the way, it's not just children with underlying medical conditions who are getting sick. And also, what are these underlying medical conditions? These are things like obesity and asthma that are very common. But also, a third of the children, I believe, who end up hospitalized are kids who have no medical conditions to begin with. Imagine if there is that kind of illness that's there and it only affected children. How might we be responding differently to that situation? And I think that's why when we're then discussing the importance of vaccines for children, we have to take into account that COVID is this now one of the leading causes of death. And I think as parents, and I'll end with this, as parents, I think all of us would say, or most of us at least would say, if there's the chance of us taking something that is a low risk, but of something terrible, if we can essentially remove that risk, I think a lot of us would do it.
And Dr. O'Leary, what has your experience been with kids and COVID?
Yeah, I mean, I think Dr. Wen really covered a lot of kind of what my observations have been, that really the perception has been that kids don't get very sick with this. And yeah, but it's really a false comparison. Pediatric death is really a rare event and kind of a tragedy in a unique way. And, we've had probably well over 700 at this point, depending on which data source you use, 700 pediatric deaths, tens of thousands of hospitalizations. Most children go their entire childhood without being hospitalized, and we've got many, many thousands. We've, right now with cases rising, here in Colorado, we have a lot of, we're in kind of a quote unquote hotspot, and, our adult hospitals are overflowing, and there's a lot of attention to that. But our children's hospital is also quite full. And we have lots of kids with COVID in the ICU right now. So it absolutely is a very impactful disease on children. And not to mention all of the indirect impacts that we've seen throughout this pandemic on children, like missed education, like lack of being social interaction, mental health crises. I mean, just to name a few, the indirect impacts on kids have been really tremendous. And just to point out what Dr. Wen said, when you look at the list of the top 10 causes of pediatric death, it's things like drowning, suffocation. If we had a simple, safe, effective intervention to prevent any one of those things, we would jump at the chance, right? And we have that for kids 5 and up now, and we hopefully will have that for the younger children as well very soon.
Rachana, Kaiser has done a lot of polling on vaccinations for children. What did this survey show?
Thank you so much for having me participate. I just want to say, like Dr. Wen, vaccination, of course, is very important as a journalist to cover, but I'm also the mother of a 3-year-old and very anxiously awaiting, when we might be able to give her the same protection that both of her parents have. So my public opinion research and survey colleagues have really done some impressive work on not just polling for attitudes among parents of children to 5 years old, or 5 to 11 years old, but also on misinformation, which I think we will get into. So perhaps somewhat troubling, in October, there was polling that they put out that found essentially that parents of children 5 to 11 years old are almost evenly split as far as being super eager to get a vaccine for their child, wanting to wait, or definitely will not. And more than 7 in 10 parents of 5 to 11-year-olds said that they were at least somewhat. A lot of them were very concerned that not enough is known about this COVID-19 vaccine and what the long-term effects might be on their children. So of course, that's going to be something that's quite difficult. It's not, we have a totally different situation, a new layer here, because you have to rely on parents to get their children vaccinated. It's not an adult just walking into a pharmacy and making their own decisions for themselves. And then again, to level set, another thing is that over half of parents are worried that their child might be required to get vaccinated, even if it is not what the parent wants for their child. So, a certain situation, of course, where that might come up quite frequently and has already, is to go to school. Expect we might see more of that, especially as we are now headed into a winter where there's pretty widespread agreement, I think, that we're about to see another surge in cases going into the colder months.
Drs. O'Leary and Wen, what do you think accounts for that large chunk of wait and see parents?
I guess I'll take a stab first. I mean, I think there are a lot of factors involved. The fact is, a lot of parents right now, as we're seeing the 5 to 11-year-olds roll out, there are a lot of parents who are overjoyed to be able to get their kids vaccinated. As Dr. Wen pointed out, she can't wait for the younger kids. And so that's what we're seeing right now, is all of these parents who are really excited to get vaccinated. The wait and see approach, I think it's a combination of factors. I mean, I think, frankly, misinformation and disinformation has really gained traction around this vaccine. This is, probably the most widely publicized vaccination effort in history, right? And so there's a lot of attention played to this. It's much easier to instill fear of something like a vaccine in parents' minds than it is to instill facts. And once that fear sort of gets in there, based on the misinformation and disinformation, and frankly, some of the media reporting, it's difficult to get that out of their heads. And that requires sort of often a little bit more information. And so that's where what I'm really pleased to see is that a lot of the vaccines are now going to be given in pediatricians' offices, family medicine physicians' offices. That's been ramping up over the last several months. And that's the perfect place for parents to get those questions answered, right? And so a lot of the parents who have this sort of wait and see approach, when they're in their pediatrician's office for something else, routine checkup, whatever, they can get those questions answered, as opposed to the initial rollout with mass vaccination clinics, where perhaps it's not a great venue to get some of those questions answered.
And if I can add too, so a couple things. One is actually, I'll say three things here. One is that I completely agree with Dr. O'Leary and Rachana about the polling data. It doesn't surprise me actually at all that these are the numbers that we're seeing, because that's mirrored in adults, right? I mean, they're the adults who have chosen to remain unvaccinated themselves, they are not likely to have their children be vaccinated. Also, at the beginning of the rollout for vaccines for adults, you also had these early adopters who would have done anything, who would have crawled over broken glass and driven 200 miles to get their vaccines. Those are the same parents who have gotten their kids vaccinated first, because they are very convinced about this. They know that vaccines are their path to some level of normalcy for their children. They want the protection for their kids, all the reasons that we stated. Then I think the wait and see group, again, doesn't surprise me. There are a lot of people who remain unvaccinated or are uncertain about vaccination for basically one reason. And yes, misinformation and disinformation ties into that, but the overall reason is that they are not convinced about the severity of COVID, and they're not convinced about the safety of the vaccine. And so if you have somebody who is more worried about the safety of the vaccine than they are worried about the consequences of COVID, then you could see how they might be hesitant themselves, but especially hesitant when it comes to their children. And so that, again, is another reason why debunking this false narrative that children somehow cannot get sick from COVID is really important, because we know that that's not the case, and because that will also help to inform parents about why vaccination is important, is so crucial for their children. I want to point our journalists to a column that I wrote a couple weeks ago on 3 ways to overcome vaccine hesitancy in this wait and see group. And specifically, I pointed out 3 things, 2 of which I think are not as controversial, and the third that is controversial, and I would be curious what people think about this. But the first is we need to share the stories of the early adopters, the people who are eager to get vaccinated, and show not only how safe the vaccines are, but also what the kids are now able to do. They're now able to have sleepovers. They can go to indoor birthday parties. They can resume their extracurriculars, things that I think many parents are really have been dying to do. And so I think that is important, showing the stories of early adopters. The second is don't blame hesitancy when access is the issue. I completely agree with what Dr. O'Leary just said, that access in pediatricians' offices, community health centers, family medicine offices, pharmacies, that is really critical. But we also have to increase access through mobile vaccination, pop-up clinics, vaccinations in schools and other places as well. And then the third that I think is controversial is I do think we should have a conversation about what it is that vaccines will replace. Specifically, masking in schools. We need to have a conversation about at what point we should be lifting masking. And I believe that if we can tie the lifting of mask mandates in schools to a certain rate of vaccination, or even something simple, like if all kids in a classroom are vaccinated and the teachers are vaccinated, that classroom at least doesn't have to wear masks. I do think that having an incentive at this point is going to be essential in increasing vaccination numbers too.
Let's dig in a little bit about the information piece of this, or misinformation. Dr. O'Leary, how can reporters set the record straight on all of the misinformation that's out there?
Yeah, this is really tricky, and this is where there's a lot of nuance in covering the topic of vaccine hesitancy, because it's really a kind of a truism that misinformation begets misinformation. So when you simply by covering a myth, you risk perpetuating that myth, because many parents haven't even heard of it. And the myths tend to be really sticky. They stick in your head. And so when you do have to cover, a specific myth, it's worth sort of understanding good ways to do it. My general rule of thumb when I do need to talk about myths, whether this is with a family in a clinical encounter, or if this is talking with a journalist, start with the facts. Make sure you label misinformation as misinformation. Explain how that misinformation is misleading, and then finish by reinforcing that fact, because really it's some of the things that we've seen with Kaiser Family Foundation surveys, for example, the leading concerns really are not based in fact, they're based in misinformation. And it's not, for example, this concern about long-term side effects, that's simply something that doesn't happen with vaccines. And, if it's not to say vaccines can't cause side effects, they do, and they occasionally cause rare, serious side effects. But we know about those in the days to weeks after vaccination. But in poll after poll, the biggest concern, both for adults themselves and for kids, the parents say that who are refusing the vaccine say it's the concerns over the long-term side effects. So, these myths, once they're out there, they're really difficult to debunk. And simply covering them risks perpetuating.
And Rachana, you're the practitioner here. How can journalists counter the information the misinformation that's out there, especially on social media?
Well, I think I have a few thoughts. Of course, it feels like you're often drinking from the fire hose, right? You can publish one story about how certain things aren't true. And then, of course, by that time, there have been thousands of retweets on a totally bogus claim about vaccines, et cetera, on Facebook, Twitter, Instagram. I mean, they're all over, let alone international sort of chatting apps that get used abroad, which is a whole other problem, right? Things that are not in English primarily. I like to think about it a few ways, sort of piggybacking on what Dr. O'Leary said. Follow the science gets said a lot, but I think at the end of the day, even though we do have misinformation on social media that is not so easily controlled, journalists are still, to a certain extent, gatekeepers of information. Who you quote and what you cover matters. And so I think sometimes the fear, that people have is in the pursuit of balance. You don't want to give a platform necessarily to people who come off as being credible sources of information on this, but really are not. And so, as a journalist, I think first and foremost, your goal is to tell the truth, not to give a false sense of balance, and therefore, give a platform to people who have views that are not based in science. So I think that's always important to keep in mind. One thing that's very near and dear to my heart, actually, and this of course depends on resources, but we at KHN and me personally, we have multiple staff who are bilingual, and we work with ethnic media sources also, because a lot of the misinformation that is out there is on communications channels that are not predominantly in English. And so I think remembering that, telling stories about that, and sort of taking a different tack in your coverage, it also often amplifies angles that are not, that are really overlooked, right? I mean, one example I was just talking about with my colleagues is, of course, social media apps in America, they do try to note misinformation in English. But when you think about the other languages, I mean, it's really untouched. And you can bet that those are definitely causing a lot of, it causes a lot of anxiety, especially among certain racial and ethnic minorities in the US who, as Dr. Wen mentioned, are already more likely to experience access problems with getting vaccination. And then when you throw this misinformation on top of it, it's really, really difficult. So those are just two things that come to mind for me.
Yeah, Dr. Wen, do you have thoughts about the fire hose of misinformation and how journalists can counter it?
Yeah, it's really hard. I say this as somebody who does a lot of media work as well. And, I think that there's sometimes this tendency or an inclination, if you will, to ignore the misinformation because you don't want to give it more oxygen. But at the same time, if there are certain myths that are being perpetuated over and over again, I also think that it's our responsibility as experts, as people in the media, to be able to debunk these myths. One of the most common ones, of course, is the one that Dr. Leary had previously mentioned about long-term side effects. That is so pervasive. And I think and the thing is, it's not just being it's not like, is somebody going to become magnetized if they get COVID, or if they get the vaccine, right? I mean, it's something that you hear from a lot of reasonable people who are asking a reasonable question. And so I do think that, in a way, when I'm addressing this in the media, I think about what it is like if I'm addressing this with my patients. If my patient is coming in with a question, I would be addressing them with compassion and empathy, listening to what their concerns are, and then answering that question directly. One of these common questions then is about infertility, about long-term side effects, about do children really get that sick? I mean, these are the types of things that we hear a lot. And I think there is a fine line between giving oxygen to actual sources of disinformation and then lifting up the issues that people are frequently asking about and then addressing them with expert advice. So I do want to say that, it's challenging to strike that balance, but I also think that addressing these sources of misinformation is part of our job too. One more thing that I want to highlight, and I had talked a little bit about this before, but just to say that local stories, I think, and interventions on the community level are really powerful. The stories of parents and children who have been so eager to get their vaccine. That's really powerful. We hear so often in the media about parents who are hesitant, but there are so many parents who have wanted to be first in line to get their kids vaccinated. And I think hearing from them is great, as is the stories of local community interventions, the getting vaccine clinics set up in schools, the partnering with churches and other trusted community voices. We should be hearing a lot more about that. And the local reporters who are on the ground, who have these connections with local contacts, I think can do so much good here.
Yeah, Dr. O'Leary, can you talk a little bit about pediatricians and family doctors as being an important voice of authority with families?
Sure. Yeah. This has been an interesting. It's been an interesting thing to watch unfold with the pandemic and the media coverage related to it, because vaccines for pediatricians and to an extent family physicians as well are really our bread and butter. I mean, it's what we do all day, every day, is talk about vaccines with families, pediatricians in primary care. And so, I've seen throughout the pandemic, all of these quote unquote authorities talking about pediatric vaccines where, that's not what they do. And that's really what pediatricians do. And so I think one of the things that I was thinking of as I was thinking about this conference was, there are plenty of pediatricians out there willing to talk to journalists, whether you go through the AAP or your local AAP chapter. And I think those are folks that are really on the ground talking with families about vaccines all the time. And those are, I think, folks that are worth talking with when you're covering these types of stories. Pediatricians in general are very empathetic individuals. We go into this we go into medicine to take care of children and really respect parents, and we respect the fact that they may have questions about vaccines. So I do think that that's a voice that we've seen some coverage of it in the news, of course, but I think we could certainly see a lot more as we're seeing more of these vaccines being rolled out into the younger kids.
And Dr. O'Leary mentioned AAP, which stands for the American Academy of Pediatricians, rather. And
it is the American Academy of Pediatrics, actually. Yeah.
Pediatrics, okay. And they have a media team that is standing by waiting to help you. So go ahead and contact them for local pediatricians if you're not sure who you should be talking to. I wanted to throw a quick question to Dr. Nguyen, and then I know she needs to drop off for a minute or two. Dr. Nguyen, access issues firsthand from your work in Baltimore. Can you tell, or how can reporters tell the story that you experienced with low-income families and access or lack thereof to healthcare in Baltimore?
Yeah, it's a good question. And again, I would emphasize that so much of the coverage has been on, in a way, and this is not just for children because the vaccines for younger children has just started. So I'm speaking more generally about vaccines, but a lot of the coverage has put everyone who has remained unvaccinated in the same category. And we know that that's not the case. First of all, people have a number of reasons for actually refusing vaccines. But a lot of people who remain unvaccinated, less true now for adults because there's been so much outreach and education and incentives given for adults, but especially from a few months ago, there are a lot of adults who remained unvaccinated, not because they were unwilling to be unvaccinated, but because there were other factors in the way. And in fact, I believe that it was just back in August when HHS, Department of Health and Human Services, released a report that found that nearly half of the unvaccinated are in the unvaccinated but willing category. So then you look at why is it that they're not getting vaccinated? And it has to do with the fact that getting the COVID vaccine is just not top of mind, which I think for those of us who work in this every day may seem like, how could it not be top of mind? But look, if somebody is taking care of their children and elderly parents, they're working multiple jobs, maybe they're going to school at night. I mean, there's so much else happening in their lives. They're struggling to make rent. They are, there's so much in their lives that's happening that it's not that they are unwilling to get the vaccine, but that vaccination has to be made the easy and convenient choice for them. I'll tell you, when I used to run school health in Baltimore and oversaw school health services in our over 180 public schools. And at the beginning of every school year, we would see hundreds, if not thousands, of families who had not met the immunization requirements for entering school. But you know what? It wasn't because they were anti-vaxxers. I mean, maybe a few of them may have had objections of some kind, but by and large, the vast majority just didn't get around to it. Maybe they don't have pediatricians that they go to regularly. They should, but maybe they haven't been. Maybe they, again, just have so many other factors, transportation, work, other access barriers. And for us, the key was to set up vaccination clinics in schools, to have buses that would bring these kids there to reach out to parents in advance. There are all these other efforts that are key, but I think we really need to keep in mind ultimately that so many of the unvaccinated, and that's going to include unvaccinated children, it's not because of some, objection. They're not anti-vaccine sentiments being expressed, but we need to get at that, and that includes not lumping everyone into the same category.
And if you look at the chat, the capable team from AAP has dropped their contact information in there for you. I think these access issues and barriers to vaccination are so important. I want to give all the panelists a shot at answering this question. Rachana, you want to go ahead with your thoughts?
Sure. I think one of the things that's really important is, as a journalist, when we think about vaccination rollout efforts, it's really important to scrutinize what your local, state, national reporters do it at the federal level, but what they're doing to ensure that some of these barriers are not very much of ones, or certainly smaller, maybe not even non-existent. So on transportation, who is taking these people to get vaccines? Where are vaccine clinics being set up? What languages are education materials being produced in? One of the things I wrote early on for KHN in the vaccine effort, again for adults, was about how I'm in the DC area, but I'm in Virginia. There was a situation where to pre-register for vaccine appointments, it was really difficult for non-English speakers to get through the system. And forget if you didn't speak Spanish, we have hundreds of other languages that are spoken in the DC metro area. And it was extremely difficult to navigate the pre-registration system to even get a vaccine appointment for adults. So, those problems, I think there is a good faith attempts by people to resolve them, but they're certainly not resolved. So I think some of those factors are really important to incorporate into your reporting. One of the biggest things too is, despite all the education and things that we hear about the vaccine is free, the vaccine is free, the vaccine is free, a lot of people are still concerned about the cost, especially they think that they'll be charged, especially if you go to a pharmacy, let's say, and they ask for your insurance documentation. Well, why would you ask for insurance if it's free to me out of pocket? But that's definitely something that still comes up in polling. So I think all of those things are really important to sort of scrutinize when we're talking about community level vaccination efforts.
And Dr. O'Leary, your thoughts on access issues?
Yeah, I couldn't agree more with both the other speakers. It's there's so much coverage of people refusing vaccines and hesitancy, et cetera, but access is a major barrier for many, many communities. And, at the recent Advisory Committee on Immunization Practices meeting with CDC, talking about the vaccines for the younger kids, they presented a survey, the National Immunization Survey that the CDC puts on every year for teens, and showed the disparities. I mean, we're all aware of the really tragic disparities we've seen throughout this pandemic in terms of hospitalizations and deaths. And yet those disparities in prevention persist. We recognized this was going to be an issue early in the pandemic, reaching vulnerable communities, yet the access issues are still a major issue. If you look, for example, at parents who said their children were vaccinated, far fewer Black parents said that they were vaccinated compared to Hispanic and white parents. But if you actually looked further at the data, there were a large proportion of those parents who said they definitely will get their child vaccinated, and another large percentage that said, I probably will get my child vaccinated. And when you actually add up all those numbers, they're pretty even across race and ethnicities. And what that tells me is we still have not done a good enough job getting into these vulnerable communities to get people vaccinated. So there are, as Rasha pointed out, there are tons of efforts going on in that area. And I think those, really are at multi-levels, national, state, but really local and grassroots, getting into communities, working with trusted messengers, working with church leaders, all of those things, getting the vaccine to where the people are, like all of those things are efforts that are going on right now, and I think really need to be continued. And I think, from the perspective of the journalist, more coverage of those success stories, reaching out to these communities, less coverage of the small percentage of people who are spreading misinformation.
Dr. O'Leary, that disparity study that you mentioned, is that available to the public and to journalists?
Absolutely, yeah. It's the easiest way that I would know to get to it is just look at the ACIP meeting website. You can just Google ACIP, go to meeting materials, and you'll see from the last ACIP meeting, I think November 2nd and 3rd, there's a slide set there that would have all of those data. Fairly easy to access.
Great. Rachana, you raised questions about children in rural areas and vaccine access. Can you elaborate a little bit?
Sure. This was just underscored actually by a story. If anyone is curious to go to khn.org, that a colleague of mine wrote. It's part of a long-standing series about how rural pharmacies are disappearing. That just underscores the problem that I'm thinking about here, which is that a lot of people live in pharmacy deserts where there's no CVS, no Walgreens, no Rite Aid anywhere down the road. And it's, so if pharmacies, of course, chain pharmacies have really been relied upon to administer vaccines for adults, and local pharmacies have too. But what if you're almost, I think the statistic is shocking. I don't want to misquote it, but I think it's somewhere around maybe 1 in 5, 1 in 4 adults lives in a pharmacy desert now in America, and thousands have closed in the last decade. So if you're a parent of a 5 to 11-year-old right now, where do you take your child if there's no pharmacy nearby? And what if you don't have a regular pediatrician or doctor? So I think, again, when it comes to access barriers, there have been efforts by states and counties to do mobile clinics. But some of those, it's not always easy to do a mobile clinic when you have a 2-dose vaccine and you're finding someone, that literally lives in a town where there isn't anyone for miles and miles. So earlier in the rollout, I think, when Johnson & Johnson was envisioned as having a greater role in the US's vaccine effort, even for adults, that was seen as a really ideal option for rural areas because you're 1 dose and you're done. But of course, that had problems. And now, of course, the only vaccine we have currently for children is Pfizer. And so how do you do a mobile unit in a rural area for a child who needs a 2-dose vaccine, doses spaced 3 weeks apart? I mean, it's really challenging. So that's just one thing that I wanted to point out. It's hard to get to those communities, of course, sometimes, but I think it's if you can hit the road and feel safe doing so, that's another thing that's really important.
Yeah,
Can
Dr.
I
O'Leary.
follow up on that, Sandy?
Yeah, please.
Yeah, so that same survey I just mentioned showed the same thing with rural areas, access is almost certainly an issue, not necessarily to the same degree. There is perhaps more refusal in rural areas. We know there's a big rural-urban divide in terms of vaccination uptake right now, but it's not all refusal. It is a lot of it, as Roshana points out, is access, and it is that there are a lot of reasons for those barriers, but we absolutely should not assume that it's because people don't want the vaccine.
And are you seeing, what are you seeing in rural Colorado and areas outside the urban centers? I mean, you've got this, I guess, a national survey, but are you experiencing that firsthand as a pediatrician?
Yes, we are. I think we're, fairly similar to a lot of the country. We have, a decent, probably the majority of the population in Colorado is in an urban, suburban areas, but we have a large spaces that are rural or frontier counties. And if you look at our map, the uptake is fairly striking. Our rural mountain communities that have resorts, in fact, where Aspen is, Pitkin County, which is, I think, 0.3% of Colorado's population, has 100% uptake of vaccines among the eligible population. If we look at some of our more, that's a resort area. If we look at some of our rural counties where there are, more ranching and farming, uptake in the 30s. So wide differences. Again, not all refusal though. A lot of that is access. These are places that have, as Roshana mentioned, maybe not even a single pharmacy that delivers vaccines. They may have, they may have to drive 60 miles to have a visit with a primary care provider. So there are lots of issues like that make it much more difficult for people to get vaccinated.
Solutions journalism is a growing trend in newsrooms. Both Dr. Wen and Dr. O'Leary suggest that journalists offer up success stories you have during this webinar. But can you describe what you mean by that, or offer some specific examples to journalists who are listening in here? Dr. O'Leary?
Sure. I mean, just thinking about some of the coverage I've seen recently about, most of the coverage, I have to say, most of the coverage has been great about the rollout for the 5 to 11-year-olds. But I've seen some stories that make me say, oh, kind of wish that hadn't been the direction they took. And that's coverage where they interview all of these parents who are voicing all of their various concerns about getting their kids vaccinated. Meanwhile, you have these clinics that are going on right now. I have a lot of colleagues in primary care, friends and colleagues that are doing these clinics right now, and there's actually a lot of joy in those clinics. One of my friends, the first clinic they did, he said it was awesome. There were kids were crying, parents were crying. The kids were crying, of course, because they got the shot. Parents were crying just with joy that now their kids were going to be able to return to normal. And I haven't seen a story like that. So I think those are stories that deserve to be told, is that those parents that are just so excited for their kids to return to a normal life.
Dr. Wen, we're talking about success stories, and I'm hoping that you can give journalists an example or two of a success story that they might be able to replicate in their own communities.
Sure. Well, here are the types of stories that I've been hearing from around the country. I have heard from parents who were homeschooling their kids, who their kids may have had autoimmune conditions or severe asthma, or maybe they live at home with an elderly grandparent who is immunocompromised. They've had their kids homeschooled and not allowed them to go back to in-person interaction. But now that kids are getting vaccinated, they're able to resume that very essential activity of in-person school. Lots of kids have been pulled out of various extracurriculars because risk is cumulative. Their parents have said, okay, we want you to be back in school, but we don't know that soccer and wrestling and gymnastics are necessarily as essential, so we're not going to let you do that. Well, now kids are able to resume those activities that matter so much to them. Kids are also able to, I think I heard the bottom end of Dr. O'Leary's comments, they're able to get together with one another again, go to movie theaters and go to indoor restaurants with their friends and family. They're able to participate in holiday celebrations in full. I mean, I'll tell you that very personally for my family, again, we have 2 kids who are under the age of 5, and so we have not yet had the benefit of vaccination. But one of the things that we've been so eager to do is to travel to see our extended family. My father lives in Vancouver. My mother-in-law and my husband's entire family lives in Johannesburg in South Africa. The idea of taking at least an 18-hour flight for us, where my 1-year-old is unable to mask, we're not going to be able to do that. But my mother-in-law is elderly, dependent on oxygen. She's not able to come here. She has not yet met my baby, who is now a toddler. We are really eager to go and do that. And I think that those types of family reunions, of the joy of kids getting back to normalcy, those are the stories that we have to tell, because frankly, our children have suffered so much during this pandemic. Remember last summer when we prioritized opening bars and restaurants rather than our schools? Remember how we have all these investments put into other parts of our society, which are also needed, but why didn't we put those same types of investments into keeping our schools open? I mean, we have made our children suffer during this pandemic because of the inaction of our various policymakers. And I think it's time for us to prioritize our kids, and giving them this vaccine is one crucial way to do that.
Yeah. Rachana, can you describe some success stories or solutions journalism type stories that either you have written or your colleagues at Kaiser Health News?
I mean, I have 2 examples that come to mind. I know that, journalists, to premise my comments, I guess, journalists love conflict and drama. We are all driven by that to a certain extent, but it's important to be balanced in your coverage. So actually 2 things that come to mind recently, like Dr. Wen mentioned, there are stories about slightly older children, but once they were able to get vaccinated and once schools reopened, really kind of in earnest, sort of more nationwide this academic year that we are in now, there were kids that were able to resume extracurricular activities, and they were just elated to be with their friends. It was so good for their mental health. And then vaccination, of course, helps sustain those kinds of activities. And I think, just reading about happy children always gets me. So, it probably works for other people too. The second thing is not so much related to vaccination as it is just recently, but this is sort of a success story. And again, sort of the feel good news category is when the US lifted its travel restrictions and people from Europe were coming to the States for the first time, and there were families reuniting in the airport, like tearful hugs and videos and just overjoyous reunions. And I think we just have to remember sometimes it's easy, I think, to, we've been in this for so long that you've sort of adjusted maybe to a certain extent that this is the way life is, but actually there's a whole world of possibilities out there of things that we had before that we have given up while we've been in this pandemic. And sort of even having a glimpse of that and remembering like, wow, these things make people really happy is sort of important to, to balance out all of the dire that comes every day.
Sandy,
So question.
Can I have one more
Go
thing
ahead.
on that? The stories I think are very compelling and very important to tell in terms of covering these types of things. But also, you can use data to help drive some of your coverage as well. So, for example, I think we're all aware, there's a partisan divide here with vaccination uptake, and we've got a very partisan America right now with red states, blue states. But if you look at the uptake, for example, across the states, whether it's for adults or kids, you can see that there are differences, right? So, certainly the Northeast, very blue area, very high rates of uptake. If you look at the bottom states for coverage, it's pretty low. But if you look, there are a lot of states in the middle that really don't fit that narrative, right? So, what's happening, for example, in Arkansas, in South Dakota, in Kansas, they have much higher uptake of vaccines for children than, say, West Virginia, Wyoming, Alabama, even though perhaps the partisan, how people vote is similar. But somehow, some of these states are getting their kids vaccinated, whereas others are still stuck pretty low to the bottom. So what's happening in those states where they're doing better? Because I think we can say that Massachusetts and Connecticut, the parents they wanted to get their kids vaccinated, but some of these other states, it's not the same story. So tell the story of those states. What is it that they're doing? It'll be things like they're doing more community outreach. They're getting into the churches. They're getting into the communities. They're popping up pharmacies. So there are a lot of stories that you can tell about what those states and those even local communities are doing to get the vaccination uptake higher.
That's a really excellent idea. Is that data CDC data, or is it state by state public health data?
So there are a number of sources where you can get state level data. Certainly, I've been using the Washington Post, New York Times, I've been using CDC. AAP has, now the American Academy of Pediatrics actually has been covering both pediatric cases throughout the pandemic and over the last several months, pediatric vaccination uptake. And so the AAP website, you can find that pretty publicly available. Great.
Question, do you think school mandates for the COVID vaccine are inevitable? And let's go ahead and start with you, Dr. O'Leary.
Right. So I think it's a little hard to predict. I think there are a lot of crystal balls out there with this pandemic, and I don't pretend to have the perfect one. I think a lot of people, there's a lot of discussion about, well, we may be at this point where the virus is becoming endemic. Let's talk for a second about why school requirements are in place. They're in place to protect children and keep schools safe. And we've had them in place for decades. They're very effective at keeping schools safe. Most parents have never seen someone with measles or mumps or even chickenpox in this day and age. And so we know that they work. The reason they're in place is to keep diseases from spreading within a school and also spreading within communities. By those criteria, COVID-19 at this point in time makes absolute sense for having it as a requirement. Now, you're probably aware there are a couple of districts around the country that have already done that. And California has said once the vaccine is fully licensed, a full biologics license application, it's going to happen in California as well. I think for most places, they're waiting to see when it gets fully licensed before they make that as a consideration. The other very difficult elephant in the room, of course, right now is that how, quote unquote, controversial this vaccine has become based on sort of the partisan divide. And so it's going to meet challenge that this vaccine, as far as having a requirement in schools, is going to be more challenging than probably any other disease we've dealt with historically in terms of requiring it for schools, because that we have, frankly, we still have a sizable proportion of the population who don't even believe the disease is a problem at this point. So it's going to be certainly controversial in some places. I think if it be, I'd love to say that in a year or two, this vaccine or this disease is going to be like the common cold, and everyone's going to have some level of protection and it won't be as severe. But I think it's a little bit hard to predict. I think once it receives full licensure for all children, you may see a lot more districts taking it on, though.
Dr. Wen, on that issue?
Yeah, I think it's really hard. I've actually been trying to not answer this question for the time being for two reasons. One is I think there is a better way for us to be addressing the question of mandates through incentives. And specifically, I think that, again, I alluded to this before, but I do think that it's time for us to have a conversation about what is it that the vaccines will replace. We've been talking about layers of protection, right? Layers of mitigation in the same way that you have layers that you wear in the winter. If you have a lot of virus, it's really cold outside, you have to put on a lot of layers. And so if you have a lot of virus around you, you do vaccines, you do testing and masking and quarantine and all these things in order to protect kids in schools. I very much agree with that. But using the same analogy, the vaccine is also the best layer, as in it is the great winter coat. And so if you have a great winter coat, and especially if the levels of virus begin dropping, what is that going to replace? I don't know that we need to start talking about mandates as much as the incentives, as in, for example, if you have an entire team that's vaccinated, entire soccer team that's vaccinated, maybe they no longer have to mask or distance or do anything different around one another. Or if an entire classroom is vaccinated, they don't need to be masking in that classroom anymore. I mean, I would much rather see us going to incentives of what can you replace or what is it that the vaccine can now do for you in terms of replacing other restrictions in your life. I'd like to do that before we start talking about mandates. The second thing that I'll mention here is, and I'm not sure if during the time that I was gone, if this was talked about, but one of my major concerns going forward is what are the knock-on effects on other aspects of public health? We have already seen, unfortunately, the reality that COVID has gotten politicized. The vaccine has been put in the middle of ideological and cultural wars in a way that is inappropriate and really should not have happened, right? I wish that this did not happen, but it has. And in fact, we're already seeing, based on preliminary data, that people who do not believe in the COVID vaccine for whatever reason are now not getting the flu vaccine. There are now all kinds of religious exemptions and medical exemptions that are being tested in various states that may bleed over into additional loopholes for other childhood immunizations. The last thing that I would want to see is for us to really focus on the short term of getting kids vaccinated for COVID, but then long term hurt all of our efforts when it comes to measles, rubella, chickenpox, all these things that we have essentially made that are vaccine preventable diseases. I would hate to see them come back because of the tie to COVID. And so how do we square this? I don't know. I want to increase vaccinations, including in the pediatric population. But how do you do this in a way that doesn't have adverse long-term consequences? I don't know the answer to that, but I think it's something that journalists and experts have to watch out for in the coming months.
Yeah. And Rachana, on that issue?
So I think it is really hard to make predictions about anything these days. I think we do know that if a governor or someone else has decided that they want to impose a vaccine mandate, for example, in institutions, higher education, and in schools, the courts have said that pretty universally have said they have the ability to do that. So unlike some other vaccine mandates that are being approached, like on the Biden administration's mandate for private employers right now, which is currently working through the legal system, I do think it's really hard. I mean, we know that childhood immunization requirements, of course, are far from the exception in America these days. We have to get vaccinated to go to school, to do so many things. But sometimes I think about how with COVID, when we do make a COVID and flu comparison, well, guess what vaccine is not pretty much universally not required to go to, public school in most states. Influenza vaccines are not. So like, where's the line, right? Where do you sort of draw it? And I think that is still up for debate. I think part of that is also, I think experts have collectively kind of recognized that COVID is here to stay. This is not something we're just going to get rid of. It's something we're going to have to live with. But until the public sort of comes to that consensus, then I think, it's easier to sort of make long-term decisions like mandating vaccines if you know that basically this really is like our permanent, more or less, future. It's going to be here.
Dr. O'Leary, explain why false equivalency in reporting is harmful on this issue.
Yeah, I think Rachana mentioned that earlier. I'll tell you a story. This is, do you remember you probably all remember the Disneyland measles outbreak, right? So a lot of press coverage at the time and front page of the Denver Post around that time, talking about Colorado at the time had the lowest measles vaccination coverage in the country. And so we were prone for an outbreak. And so the front page above the fold was a story on our vaccination coverage. And on one side on the front page, a quote from one of my colleagues about how dangerous measles was to children. A quote on just right next to his was from the executive director of one of the largest, basically the largest anti-vaccination organization in the US, with 1, 2, and 3 of their top talking points. And so what was done there was, you want to achieve this concept of journalistic balance, but you're taking what is, someone that's presenting the scientific consensus and putting them right next to a person who is really on the fringe of science and really is spouting misinformation. And don't get me wrong, these organizations have honed their talking points very well over the years. They know what gains traction, and so when they're given that kind of coverage, that is going to hurt immunization rates. And so that's one example. And I think we've seen that, for decades with climate change. You've got the 99% of climate scientists who, are in basically full consensus. And then you've got those on the fringe, yet they get often the same amount of coverage in journalistic stories. I think that has gotten much better over the years. And I do see that particularly with actually coverage of vaccines, I've seen it get better over the years, but it still happens.
Yeah, Rachana, what kind of guidance do you have in your own newsroom about sort of the he said, she said rule on equal time?
I feel like it's not like we have a prescribed policy per se. I mean, it is our jobs to be fair. We need to be fair to people we write about. We need to give people an opportunity to answer questions, of course, but it's pretty clear that our number one job is to tell the truth and be accurate in doing so. And so we don't need to give airtime. I've never felt pressure in my job ever to give airtime to someone that is just not talking in good faith about this topic and really manipulating pieces of information to kind of suit their own aims. So we just follow the data like everyone else, and that's how we call it.
The other thing I would say is you definitely want to hear from parents, of course, but that's also something that becomes difficult as someone in science and medicine. Parents, I'm a parent, but when I'm being spoken to by a journalist, it's usually more as for my expertise in whatever vaccine hesitancy or pediatric infectious diseases. But you put me next to a parent, and parents are going to identify a lot more with the parent than they are with me, right? I'm the quote unquote expert. And so that's also something that's tricky because they're going to identify with what the parent said, which may be related to misinformation more than they're identify any facts that I may share.
And we're about to move into 6 weeks of holidays. What is the top thing that each of you think reporters should be writing about holiday travel and holiday gatherings? And Dr. Wen, we'll start with you.
Well, I want people to not forget that we're actually in the middle of a pandemic still. I mean, I realize this may be really obvious to everybody who is part of this conversation, but I have certainly seen the narrative be very different now versus the coverage of COVID 2 or 3 weeks ago. Even somehow it feels like, even though we have cases, I mean, I think so many experts are saying, look at the trends that we have. I mean, we plateaued at more than 70,000 daily infections. We're now on the upswing, and we haven't even hit our holidays yet. There has not been a decoupling of infections, hospitalizations, and deaths. We still have more than 1,100 deaths every day. I mean, we are in this crisis state, but it feels like people are not paying attention to COVID, and so many people have returned to normal in a way that I think does not bode well for what happens for the rest of the winter. And so I hope that we'll continue to tell the stories of people who are being cautious. I don't mean not seeing everyone and locking down, but rather I think we need to do a lot more on rapid testing. And I think there needs to be a lot more coverage of how rapid tests are being deployed in other countries, how it's become the norm in other countries to have rapid testing before friends get together for dinner, before extended family get together. A colleague of mine just went to the UK and brought back all these tests because they're virtually free, if not free, and distributed widely. Why don't we have that here? And one more thing is, actually, one thing that I don't think that we have mentioned so much yet is about boosters. I think it's essential for us to be recommending boosters to all adults prior to the holidays. The FDA and CDC has had really muddled messaging here. I hope that they'll clarify it this week. The FDA is expected to authorize boosters for all adults. The CDC hopefully will be able to make such a recommendation. And I think that that also needs to be covered of what is it that boosters can help to do when it comes to preventing a next surge of the virus.
And Dr. O'Leary?
Yeah, I struggle with this because I agree with Dr. Nguyen. People have moved on in somewhat of an inappropriate fashion with large gatherings without masks. Who knows who's vaccinated and who's not, right? And we're seeing a big surge in cases. We're in, practically crisis mode with hospitalizations in Colorado at this point. So, that is important. We need to sort of get that message out there. At the same time, these vaccines really work well. And, for the holidays with gatherings, I think when you have, there are some individual decisions to be made here. When you have, people that are fully vaccinated and you haven't seen your family in a year, I don't think that's unreasonable to get together with your parents, with your grandparents, whatever, with everyone fully vaccinated, recognizing, certain individual issues. People with immunocompromised are not necessarily as protected as others with these vaccines. So there are some individual decisions to be made. But I also think these vaccines, even two doses without the booster, are still very highly protective against hospitalization and death, which is really what we're looking for.
And Rachana, you're going to get the final word on this question.
Sometimes I think the best way to talk about these sorts of issues and news stories is actually to do a sort of like 5 things you need to know before the holidays with COVID. They're not particularly like glamorous or sexy, but man, do they really get the point home. So you could talk about all the things that are necessary. Testing, Dr. Nguyen mentioned, getting a test before you travel and then not after you travel, and then you go to a Thanksgiving dinner. Well, what about, did you catch something on the plane or in the airport? If you want to get a booster shot because you feel like you want to get protected, well, the antibodies, we've already kind of gotten past the window where you would get the maximum antibody protection from that booster in time for Thanksgiving now. So when do you need to get that in order to feel like you might have more protection if you are eligible to do so? I think all of these things, it's almost like a how-to guide or a handy FAQ guide, before travel. And I know that people have sort of collectively moved on, it seems like, but those things are really useful. And I think people still have a lot of questions even about testing, when they should get tested, when they should get it, if they want a booster, when does it provide the protection by. All those things are still really good for people to know.
Yeah, I love your idea of 5 things you should know. Those are great consumer tips. So our thanks again to Dr. Lena Nguyen of George Washington University, Dr. Sean O'Leary for representing the American Academy of Pediatrics, and Rachana Pradhan, National Correspondent for Kaiser Health News. Resources from this webinar will be posted for your use on NPF's website at nationalpress.org, where we make good journalists better.